Welcome everyone again. Most of you will have had a welcome from me. We've had a fantastic week last week, and it's so exciting that a number of you have returned for this week. Again, please note that on the screen you should be able to see the slide presentation as well as the chat. As I note, we'll be using the chat today as part of this webinar because I want to get some information from you. So please now take the time to type in your name and your position and what country you're from, just to give us an idea of who's online. If you're having trouble viewing the video, you will notice that in the invitation, there was a link to a Dropbox which has a copy of this particular slide deck. If you need to pull that slide deck up to have a look, that would be great. So this is Module 2. If you've missed Module 1 and you're interested in going back and doing that, you can. Within the invitation for Module 2 is a link to Module 1 in the Dropbox, which will contain the recording, the session overview, and the other tools from that particular webinar. So today, what I'd like to do is just to quickly remind us what we did last week, and that's going to set us up for a very interesting, hopefully somewhat interactive session today. So if you remember last week, we looked in some detail about understanding the health system strengthening section with the GHSC PSM. We looked at what a systematic approach to human resources is, that it's a lot more than just training. And in fact, capacity development is not training. We spoke about the bus model. We spoke about the 5 building blocks from the People That Deliver the Initiative, if you will remember. And within those building blocks, you remember we spoke about engaged leaders, policy and planning, workforce development. We spoke about performance management and staff retention, and also professionalization as those building blocks. We also introduced you to a theory of change, and part of the homework was to have a look at some of those People That Deliver theory of change documents, which, if you've had a look at those, I hope you'll agree, really helps you to understand in more detail aspects of human resources in a much more detailed way. Then one of the key points from last week was recognizing that you can systematically look at your human resources systems within a particular organization by conducting an assessment. And we noted that there was a human resources for supply chain assessment guide and tool, and I showed you visually what that looked like. And also for those who are looking to do the assessment for this particular series, I outlined the assignment. And just as a reminder, that assignment was for you to develop a scope of work to conduct a human resources for supply chain assessment in your country. And so I'd like you to have a look at that. So within Module 2, we're looking at the policy and planning interventions. And last week there was quite a number of questions from colleagues in the chat. And I would encourage you to use the chat as we move along. If you have any particular questions or thoughts or things to share, please go ahead and type that into the chat. I want to help you think about human resources a little bit more as we think about policy and planning by thinking about a basic maturity model for human resources systems. I want to really take the opportunity to have a look at gender-related issues in supply chain management. And one of the key indicators for our project is women in supply chain management leadership positions. And there are not many countries collecting that particular indicator, but Ethiopia is one that's strong in that regard. I want to look at some of the principles underpinning the policy and planning aspects of interventions, and I want to explore some of the guidance and tools, and consider these again in the application in the country context. The way we're going to do that is looking at a couple of different things. What we'll be looking at this maturity model, the importance of gender, and then I'll be going through in some detail some aspects of the 10-pager. Now, if you remember, that 10-pager is also in the Dropbox for Module 1 and acts as a resource document. If you remember, one of the key features of this particular series is that it's not just the module, that in fact there's a lot of work for you to do if you really want to get a deeper understanding of the topics that we're talking about. Now, this is the module outline for this module 2, which is the HR policy and planning interventions. And I just want to go over that with you. A reminder that the resources for this module can be found in that Dropbox. Now, for each of the modules, what I'm doing is giving you some background reading. And you may have already noticed that this background reading, a lot of it comes from that 10-page or more detailed document. And what I'm trying to do over this 5-part series is to get you to think more deeply about HR issues and equip yourself so that you can apply HR activities in a systematic way to your country. Now, yes, you can just look at these webinars and get a general overview, but the real understanding is only going to come if you do the background reading. And this means you're going to have to find 5 or 6 hours each week of these modules in order to do that. So there's a reading about maturity, there was a reading about gender, there was a reading about professionalization. Now, this came up last week as a particular of interest, and we're going to talk about professionalization today. And then also there's a couple of case studies here which I wanted you to have a look at, one about Burkina Faso and one about different people's approach to professionalization, some case studies from PATH. So again, I would encourage you to do the readings, and if you missed the readings from the first module, then please go back and do that. What just as a general question, would anyone like to just type in something that they learnt from the readings that you found particularly interesting? If anyone just wants to type in, was there anything from the readings that you found particularly interesting that you wanted to share with people around us? While I just quickly note to Mr. Dorwit that Alexis, you should have Dorwit's email address from University of Addis. I was wondering if you don't mind just emailing him the link to this particular session from that would be very helpful. No one wants to share anything from the readings? As I said, when I was a professor at the university before taking on some positions working in international development, the hardest thing to do was to get students to do the background reading. So again, I would encourage you to have a look at that, but please, I see some people typing away. If there's a particular thing you found interesting from the readings, please type that in and share with the rest of us. When we talk about supply chains, we realize that we have supply chains from our different countries that have a different level of maturity, a different level of maturity from ad hoc up to integrated. One of the interesting things when you look at maturity models, and there are a number out there, is that you can have a 3-step maturity model, you can have a 5-step maturity model, there's even a 7-step. In this particular session, I just want to talk about 3 phases from a simple maturity model that helps us to understand maturity. So this sort of ad hoc phase, and you can think about your own country as we have a look at this. There's no formal logistics roles and processes, fragmented efforts across actors, different people doing different things, and there seems to be a bit of a scramble to try and get commodities to people. In an organized phase, such a system may have standardized systems and roles. So we've got a few more SOPs organized, we've got some resources mobilized, we're starting to really get those products to people in a more regular fashion. And then we've got right up to the system that is integrated phase, where people, functions and levels are all interconnected, where the different teams, whether it's procurement, warehousing, LMIS, are not siloed, but working together. And if you had the opportunity to read the document that explains this more completely, you can see that the capacity development journey of countries is a journey, often from ad hoc all the way to integrated. And the countries that we work with in our group, within PSM, are on this particular journey. So what does this mean for workforce? So what I've done is I thought about this a little bit and taken that ad hoc, organized, and integrated aspects and applied it to workforce specifically. So again, as you think of your country, is your country one where roles are not clearly defined, where there's emphasis on short-term training, where there are limited supply chain management dedicated staff, often with other duties? I would describe, if this is your situation, I would describe that as more of an ad hoc approach to human resources within a supply chain context. It might be that other features of the supply chain are more mature. But an organized phase would be where you'd have roles and responsibilities are clarified and documented. So you'd have job descriptions, you would just have standard operating procedures. There's an emphasis moves to improve the systematic management of people and development of institutions, both human resources institutions and academic institutions, rather than simply trying to equip individuals with the competence for the supply chain. And there's this increasing effort to capacitate existing cadres. And then we move up to fully integrated. The fully integrated is high-performing teams are formed and supply chain managers empowered, where you've got supply chain managers really making changes and having the authority to make change. And if you remember from last week, this is one of the outcomes we're aiming for countries to have. And that HR systems are fully support the management of staff from hiring to exit. Individuals are on a clear trajectory to a professional supply chain management career. So these are the particular phases that I'd like to put to you, gives you an idea of the maturity of the human resources systems. Thank you to Victor and to Anita for sharing some of the things they found from their readings. Great that you found that interesting. I'd like now everyone to think about these two questions here in red on the screen and see if you can type an answer for me. What is the level of maturity from your experience so far in your country of the country you're trying to improve? What's the level of maturity of the human resources system in the country you're trying to improve? And whichever level you're at, what do you need to do to get to the next level? So this is the question I want you to ask you, and I'd like to encourage you to type this in the conversation for others to experience. Because it will be interesting. There'll be a number of people who will have similar experiences here. So please go ahead and type away. So what is the level of maturity of the human resources system in your country? And what do you need to do to get to that next level of maturity? I'd like you to type that into the conversation area so that others can get a feel for where your country is at. And we're all on the journey. The other thing to note is that these lines that are here are not always clear, and sometimes people might be in between particular phases, and that's fine too. But please take the time to make a note for us. Even though I'm going to move on, please take the time to type away to share where you're at. And also at this time, just any particular questions. Again, unfortunately, with these Skype times, is we only have a little time to talk about these things. But if you have particular issues with regard to maturity, then I'd love to hear them. Also, like to get you to type in the current maturity level that you think. One of the other things I'd like to move on to now is the importance of gender-related issues. I gave significant time to the pre-reading of the gender-related issues in the for this particular module, and I noted that Anita particularly has a message here to say that she's quite intrigued about the gender issues. And the point she's making is it's more emphasized in writing and less in practice, at least in so many countries where I've been. And Anita, that's exactly the situation. If you get a chance to see the report that Ethiopia recently published through PSM, they did an analysis of women in the supply chain and really found out that the discrimination was real, and they were challenged in order to have a look. So keep those comments coming. Thank you for typing in there. It's great for everyone to see different people's experience. But for those of you who are thinking about gender-related issues, had a chance to read the material, or even now that this thought is provoked, what new insights did you gain from the reading? or what things are concerning you about gender issues in the organizations you're working in that you want to talk about. And thank you for your comments about phases. That's keep those coming through as well. Hopefully, different countries can see that some countries are similar to your own. So I liked Anita's comment that she noted earlier, and that is that gender issues might be good on paper, but what's actually happening in the system in order to make changes so there is more gender equality in the workplace. And I want to touch base on a couple of points from the material. Now, one of the things that we're doing as a project is encouraging systematic approaches to human resources. And as we are in a position to review policies and procedures and approaches, then what we're looking to do is to make sure that those reviews are able to, any new approaches we put into place, take away any discrimination in relation to gender. Now, the main things we want people to think about when you're thinking about gender is around pregnancy and family responsibilities. Now, often in gender discrimination, we immediately think about discrimination against women and girls, but also these things can be discrimination against other family members, depending on the family makeup. So what we're thinking about is the way we work, or is the way we, the systems and the policies and the procedures that we have in the workplace, are they such a way that they cause a discrimination? So in other words, is it possible for women who are pregnant or have family responsibilities to engage in the workplace just as much as men? Occupational segregation is that sometimes, and supply chain is one of these, is the workload or the physical nature of the work, or the lack of consideration to safety in terms of the hours of the work, or not thinking about security in relation to travel sufficiently, that there becomes an occupational segregation where women feel that they cannot participate in particular jobs because of how the jobs are set up. Then wage discrimination. People who are doing the same activities in the same workplace should be getting the same wages. We do understand in different environments that there is discrimination. And then sexual harassment. And that is a situation where women or men, but this is mainly appears to be something against women, and you will be aware of this in the international media with the Me Too movement recently. We need to create environments where there is an absence of sexual harassment. And again, I just wanted to highlight this, that this is really important. And all of you who are working in different countries, as we are reviewing supply chain procedures to do with human resources, we do have an opportunity to remove as much gender discrimination as we can in a particular context, sometimes simply by just raising the issue and thinking about it. The overall aim that you should have is to remove gender discrimination in the workplace through the introduction of gender transformative interventions and strategies. Now, this sounds fancy, but when you have a look, there is a lot of simple and straightforward things that are common sense that can be done in order to remove a range of discriminatory practices from the workplace. Whether it's as you're setting up procedures for the hiring of staff to ensure that in the selection committee there is a balance of women and men as part of the selection committee. When you look at constructing job descriptions, that the activities and tasks that are in those job descriptions can be equally done by men and women. Or if there is a physical task, that there is significant or sufficient workplace aids that will help people with a range of abilities in order to do those physical tasks. If you're thinking about people with pregnancy and family responsibilities, is there opportunities for perhaps children to be looked after while they're at work, etc.? Now, these are things to think about and certainly have a cultural context. And we know that there is a strong cultural context for these. So please, I'm not being anti-culture in any way, but we want you to raise the flag as you think about human resources policies and procedures to see what opportunities there are to remove any gender discrimination from workforce-related activities. And again, I would refer you to the pre-readings, and there is also, for this week, a post-seminar activity that you can do, a little course to help you better understand and address gender discrimination in the workplace. This is quite a big issue, and I've given you lots of materials to read through. We're just touching on it here. Again, if you have any particular questions or comments, please type them in the chat on this issue so that we can address those for you. Again, a reminder that you can feel free to type into the chat at any time during our discussion today. We're going to move along, and under policy and planning, from my perspective, there are 4 key areas of intervention. And if you remember last week, we spoke about a human resources systematic assessment, and that assessment could reveal weaknesses in policy and planning around these particular areas. A lack of recognition of the critical importance of supply chain, inadequate financial resources, a lack of data on workforce numbers and the future pipeline, not of health commodities here, but the future pipeline of people, the human resources. Just a reminder, if you can be muting your microphone, that will be helpful to us all. And then there is often a low prioritization for professionalization in the workplace. Thank you, Felix, for your comments, and thank you, Jane, for those with regards to gender. Very interesting, and yep, policy. So these are the 4 particular areas we're going to look at, one at a time. So the first one is this lack of recognition of the critical importance of the supply chain workforce in the health system. Now, the way that this might show itself is situations like the following. Supply chain leaders or managers are not at a sufficient level in the organization to be considered important. So if your supply chain manager of an organization is a lower level compared to other people in the health system, then they're not invited to meetings. And this next point, they're not at the table. So important that the top positions of managers and leaders in a supply chain organization are at an appropriate level, that they are considered senior by other sections of the organization or the healthcare system. If they're not, then they will not be listened to. The other one is that often within ministries of health, there'll be particular groups will meet and make decisions about programs, particularly EPI, HIV/AIDS, family planning, MNCH, global fund submissions, Gavi submissions, etc. And I hear from many countries that these particular planning meetings go ahead, but supply chain leaders are not at the table. There is a program function without supply. And what do we know? We know that there's no product, there's no program. And so if there is an absence of supply chain leaders, there's this lack of recognition of the importance. If there's no HR strategy, if there is insufficient number of staff, if there's an absence of a professional approach, and HR issues are not on the National Supply Chain Management Technical Working Group agenda, if any of these things are in place, then there could be a recognition problem. So I want to ask you, if we know that this is an issue, lack of recognition, and we know that these are the problems that we can notice in countries, what, from your perspective, could be some of the answers? What could we do? Surprise me by typing in. I'm not the person with the answers. We have 21 people from around the world. Tell me what you think. How do we improve human resources recognition? You can see Anita typing. Others, type away. What do you think? I'm going to wait till at least I have 2 people type. So type. Also needed an excuse to have a mouthful of coffee. It's 10:30 p.m. in Australia, so good morning or evening to everyone else. So Anita has mentioned more advocacy, so thank you. Anita, what form do you think that advocacy should take? Patogo, he's writing a message for us as well, and as that comes through. So one of the interesting things about advocacy is what's the message and who should the message go to? So Anita, if you ever thought about that, I'd love to hear that, so type that in. Okay, as Patogo's message is coming through, I want to give you some thoughts from my experience. So we could be revising organograms with reference to leadership positions. So when we're talking about that, we're not just talking about simply changing an organogram, we're talking about regrading of positions to ensure that the appropriate level. And there's a process within organizations for that to happen. Revise the term of reference and approach to consult supply chain management leaders. So whenever you have EPI or other programs, it should be that any terms of reference for those sort of groups or the general approach the ministry has to program planning in the health sector should involve supply chain at the table. And you need to find out what are the particular documents, decrees, or policies that direct those discussions, and wave the flag to get supply chain at that table. But as Anita says, this requires advocacy, and you have to be able to explain why. And the why is pretty straightforward when it comes to programmatic considerations, is that commodities takes time, effort, and organization in order to plan for appropriate programmatic distribution of commodities. Now, what's interesting is that if you don't have data, you can't make decisions. And when it comes to assessing staff needs, we need to be able to do that in terms of numbers and competence. Do we actually know how competent the staff are? Do we actually know how many staff we need based on the workload? And these are things that you can find out with data. And sometimes we need to provide this data, organize this data in order to get people in hierarchy of ministry or other leadership to really understand. And this is a big one, establishing the HR for Supply Chain Management Working Group and ensuring that the human resources is on that particular agenda. So again, within that 10-page document, that is one of the resource documents in the Dropbox for Module 1, you'll find more detail about these. But again, just raising those points. We're talking about recognition and advocacy. Another point I'll make about advocacy is that often people don't understand the money that is saved by investing in people. For those of you who are a bit more widely read on human resources issues, you may have noted that the World Bank released some report and figures with the WHO last year that said that for every $1 invested by countries in the human resources in the health system, there is a 7-fold return on that $1 investment for the health and the productivity of the nation. Wouldn't it be great if we had that sort of data specifically for supply chain? But what's interesting, if you look at the supply chain video, the video that the World Bank and WHO put out, the supply chain cadres appear 15 seconds in. So they're included in that assessment. For every $1 invested is a $7 return on investment in the economy. Just pointing out that depending on who your audience is, you will need to advocate with the right material. So how do we improve this recognition? So some of the other activities might mean that you need to have a meeting of stakeholders in the country and have an external person come in as a catalyst. So for example, this is something that people that deliver might do. It's something that you may choose to invite a consultant to come and help to have an external person to have this sort of discussion. I want to move along, and just as I do, I want to just make the comment that Anita's made a comment here that advocacy to the decision makers in the government to consider making HR a critical element of the planning of health systems. Absolutely. And some of the figures that you might consider for that advocacy might be things like staff turnover rates. It could be things like vacancy rates. It could be other surveys that you do to show health workforce issues to bring that to the agenda. Or it could be other advocacy documents. So, for example, last week we spoke about the people that deliver theory of change. There is a 2-page picture there that is very good as an advocacy document. We also noted that in workforce development, we have our 2-pager also in the Dropbox that can be helpful to that. I want to move on to, as a advocacy document, I want to move on to the next part here, and that is inadequate financial resources for workforce development is also a key issue. I want to test you out here and ask you, what human resources costs need to be considered for sustainable HR systems? What human resources costs need to be considered for sustainable systems? I want you to just type some single words into the chat. I'm going to type the obvious one, and that is wages. Without wages, you can't have a workforce. But what are some of the other costs related to human resources if you've got people working in an organization? What are some of the other costs? Please type them in now for us. Anita, you're being very active on the chat. I'm excited to see that we have 19 people on the Skype, and I would encourage all of you to be using the chat. All your information will come through. Training cost is a big one. Another one, Victor as well. Again, anyone, what are some of the other costs apart from human wages costs that are human resources costs? One of the things that you can do, of course, is in some countries, in many countries, their budgets are freely available to have a look at. And that's one of the things we do when we're doing an HR assessment, is having a look at the budget for the supply chain, and particularly what budget lines are available for human resources. So we've got the cost of recruiting, training costs. Okay, there's some good ones. See here, I've got a whole page of them. So we've got wages. What about superannuation? Advertising we've got. What about supportive supervision costs? Travel, DSA, training and education costs. Good. Retention. So that is financial and non-financial incentives for retention. And what about maintaining a safe, effective workplace? Health insurance is another, if your company or the organization offers that cost as part of a package. So as you can see, there's a range of costs. And often we find that the budgeting system of governance around human resources does not take that into consideration. Now, this is a fantastic tool here, this resource requirement tool. It's a WHO tool that is basically an Excel sheet that helps you to plan in not only wages, but other aspects of human resources costs to be able to get a real indication of what a budget for human resources issues might look like. And so I would encourage you to have a look at this particular tool if you wanted to look at something that you could do as an activity to help really capture the true costs associated with human resources system. If you've got any costs that you think I've missed, then please type them in. The next interesting area, policy and planning, we're saying that something's lacking and what are the actions that we can take. This lack of data on workforce numbers and a future pipeline of the people coming. So this is demonstrated by the absence of a 3 to 5 year plan. If the supply chain organization hasn't got a 3 to 5 year staff plan, both estimating the numbers of staff it needs over that time period and also the pipeline of staff, in other words, those coming through the system from university, from other courses. If you don't have that understanding, then you are at risk of either running out of staff members or having too many. Very unusual to find a country that has too many. It's usually that there is not sufficient, and so by planning. Another one is lack of succession planning. And this is a very interesting one, and one that we'll pick up in some detail in Module 4. But basically, succession planning is, in a particular organization, there are key supply chain management positions that if those mid to upper level management positions, if those people left, there would be a critical loss to the organization. A good organization will be planning to build up people within the organization as understudies of different positions. It's not necessarily say that those people are in line for those jobs, but you're developing a broad range of skills so that there are more people with the skills in the organization to be able to cope if key people are leaving. One of the big things I hear when I go into countries is this, Andrew, there's not enough staff to do the work. So I want you to put yourself in the shoes of the Minister for Finance or the Undersecretary in Health. And you're going to him or her and you are asking for more staff. What is the first answer you're going to get? First answer is, I've got no money. Then the second answer is, what evidence have you got to show that you need more staff? And one key point here is that you cannot ask for more staff unless you have evidence. One of the other key things is that, as we noted so far when we're speaking about human resources, there are a lot of things to keep track of. There's the money bit, there's the training bit, there's the onboarding bit. And again, we're going to talk about these in detail again in Module 4. But all of this information about human resources needs to be collected and it needs to be archived and accessible in the system. Now, human resources information management systems are essential if we're going to monitor and manage human resources in systems. Now, this HRIS system is what it's called, Human Resources Management Information System. So again, a reminder, we're saying that one of the key policy and planning deficiencies can be lack of data. This is how that lack of data can be demonstrated. So of course, the next question is, what can we do about it? And again, we're not talking about specific activities that can be undertaken in countries. So this is one of many different tools. This is a WHO tool that helps you sit down and think about projecting workforce supply requirements. So this helps you think about, well, with the staff that you've got, who's going to retire in the next 3 to 5 years? Who's likely to move away because they're going to go to another country, or their spouse is going to move, or they might just leave for other reasons? What's the turnover rate we usually expect so that we can plan for people leaving? Are we opening new hubs, new warehouses, or other things in the next 3 to 5 years so that we can plan for those staff? On the other hand, which are the academic or professional institutions that are producing potential supply chain personnel in my country? And how many will they produce over the next few years? How many people can we expect? So I think you can appreciate that you can, with some simple maths and some systematic thinking, do a human resources plan that projects for workforce supply and demand requirements in terms of numbers for an organization. I had the pleasure about 4 years ago of doing one of these for the country of Vanuatu. And it was a big eye-opener because just because someone leaves an organization does not necessarily mean there's someone ready to come on board. And we know in human resources for supply chain that there is a lot missing. There's a lot of people missing. And so we need to plan this. One of the other tools that we have, which is a really interesting tool, is this Workload Indicator of Staffing Needs. Now, this is a tool that helps you to analyze the workload in a particular environment and determine how many staff you need in a particular facility to get that particular work done. It is a little bit scientific, so you do need a little bit of help to get the understanding of how this works. But it's all open access and free software, and there's a group internationally that do this. What was interesting is this was applied in Namibia, and one of the pre-reading documents I've given you is the results of this particular study in Namibia. Two important things. One was that it showed that in a number of warehouse environments, there was a shortage of people. A couple of other warehouse environments, there was actually too many people. So they were able to rearrange the people. But it also demonstrated that they needed several new staff in order to cope with the workload. And this evidence was provided to the Ministry of Health, and they were able to lobby the government in order to get more positions. So that's an interesting case study, a good example. Another way that this particular tool was used in Namibia was at the service delivery points, the health centres themselves. They actually did the study to look at how many staff in the particular clinics and hospitals were involved in activities to do with supply chain management, and how much of that time was that taking up. In other words, what was the supply chain management workload in those facilities? And what they were able to discover is in another facilities, there was up to 1 to 1.5 full-time people doing supply chain tasks in those facilities. But the only people they had in those facilities were nurses or nurse aides. This country of Namibia also has a shortage of nurses. And what they were able to do is to be able to say, well, hang on a minute, in this facility, we actually need 4 nurses, not 5, but that 5th position, we need to be a supply chain person. So let's put in a supply chain technician. In that country is a pharmacy technician in order to look after the supply chain function. So the Namibia case study is quite interesting and demonstrates how the use of workload numbers can help, workload data can help give the evidence necessary to lobby for new staff members or a reallocation of staff members. The other resource that I want to highlight to you here is this IHRIS suite. Now, this is an open source software which you can use as your human resources management system. It's a system that's open access. It's available to download from the internet. It's also an activity that you can put in your work plan, and we have experts at IntraHealth that can help set that up. What's interesting to note with the new systems available for this is it's cloud-based. Now, this is important, is that the requirements for countries now with regards to computer support or backup and maintenance of servers is much reduced, but you do need to have internet connection that is relatively regular, but it does have an offline feature. But in short, governments need to have a human resources management system, open access, so free information systems are available, and there is low-cost ways of being able to maintain those systems over time. Again, I'm giving you high points so that you can take some time to look at them in more detail later. The last one of these aspects that I wanted to get onto, which we spoke about last week, is about professionalization. Now, professionalization can mean different things to different people. Some people are actually very scared of the word professionalization. So I would say that you have an issue with professionalization if the following things are in place. So low priority for professionalization of the supply chain workforce is demonstrated by supply chain management roles are given on top of existing roles. There's an absence of dedicated supply chain management positions. Staff given supply chain management roles without the required qualifications or skills. There's no career structure, and there's no supply chain management professional organisation present in the country. All of these are indications that there is a lack of professionalisation of the supply chain management workforce. Thank you, Felix, for your comment with regard to data projections. As with any projections, they always have a lifespan. Usually I've seen sort of data used in 3 to 5 year planning, and about halfway through the planning cycle, the data is re-looked at again in order to make adjustments. But if you don't do some analysis and data at the beginning, then you haven't got the evidence from which to make a decision. But you are correct that any decision that's made on data, that data has a life and needs to be looked at. So thank you, Felix, for your question. Back to professionalization. So I want you to think about your country, and one of the interesting questions that people ask is who should fulfill supply chain management roles in a particular country? So think about your own country. Who are the people that should be looking after supply chain? And my other question is, do pharmacists make the best supply chain personnel? Now, I'm being very cheeky here, as these is very hot topics to talk about, and we could have a whole session on this particular topic. But just now, I'm interested in gauging your reaction. I invite you in the chat to make a couple of notes for me. Who should fill supply chain management roles? And you might want to say your country. And I'm also interested if you have an opinion on, do pharmacists make the best supply chain management personnel? I'm going to have a quick drink of water. Please type away. Again, I noticed that we have 18 people now on our call, and I would really like to get some more opinions. Thank you so much for those that have been typing, but please type in who should fulfill supply chain management roles, and do pharmacists make the best supply chain management personnel? I'll wait for a couple to type, but please, the floor is open for everyone to be typing this in the conversation as we go. Now, this is quite an interesting question, and one of the resources that you have in relation to that, and People That Deliver has a range of documentation that helps you think about systematically supply chain roles and think about who should have them. So thank you, Dorwit from Ethiopia. Supply chain management involves many stakeholders, many professionals. And the textbook answer, I must have had a conversation with you, Dorwit, at some stage. So other comments are coming through, and I would encourage people to have a look. Now, the couple of statements I'd like to make. One statement is, whoever is looking after supply chain needs to have the appropriate competencies to do that job properly. The second statement I would like to make is that supply chain staff, who they are, varies between countries. If we take a country like Australia, for example, within manufacturing and within the supply chains that go from the manufacturer to the wholesaler, and from the wholesaler to community pharmacies or to hospitals or to clinics, there are hardly any pharmacists. There may be a pharmacist involved in the organization for quality assurance, but all of those supply chains are actually run by supply chain management professionals who aren't pharmacists and run very well. But then you go to a community pharmacy or a hospital, and in those environments, you'll see that pharmacists or pharmacy technicians have a significant role. What's interesting in low to middle income countries is that historically the supply chain systems have grown up in pharmacies and have stayed there. So we have a situation, like Jane notes in her comment, that legally in Kenya, the policy requires that pharmaceutical personnel must be present. This is also the case, I understand, in Nigeria, in a number of other countries. What is interesting to note is, if you look at the standard competencies of a supply chain management, of a pharmacist degree, pharmacy technician degree, then often there is very little supply chain. There may be a little bit, but not very much. A supply chain professional would usually do about 12 months full-time study for an entry-level supply chain, just as an idea. Those comments are coming through, so thank you to all those comments, all great comments. And it sounds like you've been reading some of the background material, and all those comments I would agree with, and that is that it's important that there's a team of people looking after the supply chain, that whoever is being given a particular job description must have the competency to do that job. And clinical staff, such as pharmacists or pharmacy technicians, do not necessarily have supply chain skills. They can get them if they've had the right training. And that's the particular point that I wanted to make. Thank you so much for being active in the chat. That makes things really interesting. Now, again, we haven't got so much time to go into this in detail, but what's interesting is that professionalization, this is a professionalization life cycle. Now, if you really want to grow a profession, the suggestion is that you actually start at secondary education, so high school, and then also go through pre-service, graduate, employment, career progression, and continuing professional development. Now, we're going to pick up on some of these issues in more detail next week because we're going to talk about in Module 3, education and development of competence for supply chain. But this particular life cycle approach for professionalization suggests that for under-recognized cadres, such as supply chain professionals, that we could be thinking more systematically and thinking about, well, how are we creating awareness in high schools about the importance of supply chain positions? What are we doing in other education avenues to really wave that flag on that? So I just want to note that. What does a professional supply chain cadre look like? And I've mentioned some of these things already. Supply chain management has a dedicated position, not just given to someone else to do. There is demonstrated competencies through academic or professional credentialing, so the people taking on supply chain jobs have the credentials to do it. There's a career structure, and there's also a professional organisation present to really encourage that group. And as we think about activities, obviously these activities can be put into place as part of an overall approach to professionalization of supply chain workforce. Again, we're getting to the top of the hour, so we're running out of time, but I wanted to show you some resources you can have a look at here. This is a list of a range of professional associations around the world that are supply chain management professional organizations. I'd like you, as a bit of homework, to take the opportunity to click on these links. You've got a copy of this slide deck in your in the Dropbox, and have a look at what some of these different professional associations offer, and they all have different specializations. I also want you to note that IPHL, which is International Association of Public Health Logisticians, as a listserv, they're not a registered professional association, but as a listserv, have a lot of things to offer as well. So that's there as a resource. Now, you can't see this particular slide very well, and again, I'm putting it here for you to have a look at as a resource. But this suggests what a career pathway could look like for a supply chain professionals in a particular country. It's saying that you can have a generic entry-level supply chain person, and those supply chain people can get specialization in different functional areas of the supply chain, moving up to management and directors, and that you can have a particular framework of promotion based on particular qualifications to get there. Again, I'm putting this here today for you to have a look at. So the question can be, well, how quickly can that happen in a country, Andrew? So there's a Mozambique story that's here that I'm just going to mention to you. And basically, I've been involved with Mozambique in one way or another since 2011, when a assessment was done and was realised, the government itself realised they wanted supply chain management professionals, not just health people, to run the supply chain. This is just a picture of a visit where I had there last year. Now, in 2011, we were able to get some of the government supply chain people to a conference to discuss the issue. 2013, there was actually a strategic plan that actually wrote this into the strategic plan. 2014, there was a detailed assessment. In 2014, there was a further conference. And what was interesting is it took until 2017 to actually submit a dossier to the Ministry of Health and Public Service in order to have this considered. Now, what I'm very excited to tell you is we're in 2018, and I've just heard from Dimitri, the country director in Mozambique, that the Ministry of Health is supporting, fully in support of what's described as a supply chain specialization that any person in health can achieve. So it has 3 different levels, like you saw on the previous slide. but this is going to be put into practice. So if you're a pharmacist or someone else in health or engineer, for example, you could take on the extra training for a supply chain and get that credentialing, and that will be recognized in the public service structure. So this is exciting. So watch this space for some more details about that particular one. Now, just in closing, and we've reached the top of the hour, the particular assignment, I want you to think again about your country context, or if you work across a number of countries, to choose a country. What is the current level of maturity of the supply chain in relation to its human resource systems? Why have you come to that conclusion? And what general sequence of steps and activities do you need to undertake to move your country to the next maturity level? So this assignment is asking you to think about maturity. It's asking you to think about the current maturity level of supply chain human resources in your country. Why have you come to that decision? And then what are the steps that you think you need to take to improve that maturity? And to get to that, you can look at this module, the pre-reading and country examples, and also you'll find some information in module 1. Now, 1 hour is never long enough to talk about these things in detail. So what have we done today? What I've done is to give you an overview of maturity model for supply chain, and particularly focused on human resources maturity in the supply chain. I've emphasized the importance of gender issues when it comes to the revision of supply chain policies and procedures. And then, as part of policy and planning interventions, I've pointed out 5 different areas of focus that we should be making when it comes to policy and planning. And with that, I want to thank you so much for participating in today. I'm sorry that we have to finish a little bit abruptly, but a number of people have another call to go on, and I'm unable to stay on the call today. But this will be recording in the Dropbox in the next couple of hours for you to have a look at. There are resources for you to look at, and if you've got any particular questions, then I would ask you to send me those. And I would like to thank you again so much for participating. And for all those people typing in the Skype, thank you so much. It makes it much more interactive, and it's great to see people. And I would like to wish you a very enjoyable day. Thank you very much. And you'll see an invitation come out for next week, which is actually the 17th, which is Tuesday next week. So thank you very much.